After years of decline, incidences of cervical cancer here has reached a plateau. As we mark Cervical Cancer Awareness Month, doctors hope regular health screening will bring the numbers down even further, and men have a role to play.
Okay.
Cervical cancer is the 10th most common female cancer in Singapore. Every year, more than 200 women here are diagnosed with it, according to SingHealth.
I was diagnosed in 2019 end of year when I went for my regular checkup. So they're telling me there's some issues with my pap smear result.
Strains of the sexually transmitted infection, human papillomavirus or HPV, play a role in causing most cervical cancer. As HPV infections are usually asymptomatic, doctors urge women to attend regular screenings. Early detection may also prevent the infection from progressing to cervical cancer, but many fail to do so.
We do see that the decline has stagnated since 2010, and that is likely related to non-compliance to cervical cancer screening among Singaporean women. A study has actually shown that only 50% of Singaporean women are actually up to date with their cervical cancer screening.
Dr. Lim says HPV vaccination could provide up to 90% protection, and that coverage should extend to males as well.
Men who are vaccinated would have the added advantage of preventing transmission of HPV infection to their partners as well.
Doctors say that some men may be hesitant to get the vaccine because of misconceptions that HPV infections only affect females.
They could be asymptomatic, they don't realize that they're carrying these viruses, and they can actually go on to infect their partners. HPV can actually cause things like penile cancer, anal cancers in men as well.
For Lydia, she hopes there could be more awareness about HPV.
I was married when I was 18, and I only have one partner my whole life until I got divorced. So lately I've been walking around and I was asking myself, why was it me? Men can be the one that bring the virus back home.
A school-based HPV vaccination program was introduced to all Secondary 1 female students in 2019. Since then, more than 90% in each year's cohort have received their jab. As for HPV vaccination for males, the Health Ministry says it's unlikely to be cost-effective due to the low disease incidence. Nonetheless, it's monitoring the trend of HPV infections and will review its policy as and when new evidence emerges.